Okay. Hi guys. Welcome to this presentation today. So I'm here today. Let me tell you something about myself. So I'm a fairly new pediatrician by myself, but I believe that it's something that is in a positive way. When I That gives me a positive way to talk about how to prepare the exam, because I feel like most of the times it's usually a lot of people who have had a lot of experience. And I'm through with my FOP and TAS and AKP exam in one go in the last 1 year period of time. So let's begin. Okay. So a little something about the exam. AKP is an applied knowledge and practice exam, and not necessarily does the exam have to be that you need to give FOP TAS first and then you need to give AKP. You can give it in any order in MRCPCH. So if in case you're planning to give your exams in the other order, a lot of people that I've known have given AKP first and then gone for FOP and TAS. You can do that as well. About the structure of the exam, there are two exams with 60 questions each, and each exam is 2 hours, 30 minutes. So there's one exam in the morning, and then there's one exam in the evening. And yeah, so there's one exam in the morning, one exam in the evening. Each exam 2 hours, 30 minutes with 60 questions each. And there are two types of questions in the exam. One is the best of 5 questions, and the other type is the extended matching questions. There are no negative marking. There's no negative marking in this exam. Moving ahead, when and how to take the exam and what is the cost of the exam, just for your idea, I've put it here. So there are 3 exam diets, one in January, then in May, and then in September. And the exam booking opens 2 months prior via the RCPCH site. So the exam booking opens 2 months prior via the RCPCH website. And the cost of the exam roughly for the foundation FOP exam is 455, TAS is 455 pounds. For AKP, it is 870 pounds. Moving ahead. Okay. So now coming back to how do we actually go about the exam, which I've had a lot of questions from a lot of people that they're very confused because the material and data and all the books, study material is a lot. So where to start and how to start. So if anybody is there, if anybody can tell me in the chat box as when they're planning to give the exam, and whether you are planning to give the exam by the end of this year, or do you have like a time frame of 3 to 4 months, or you can speak up also. Okay. All right. So I'll just discuss in general. Okay. So if you're planning to give the exam more than 6 months, then I would suggest that you have a bigger time frame with you. So you go with more reading. So you start with reading survival guide. That's actually true for both. If you have more than 6 months or 3 to 4 months, the main book that you should read, or you should at least give like a rough read, is survival guide. You start reading the survival guide. I'll tell you in further slides about how to do smart study from survival guide. And then if you have more than 6 months, I would suggest the AKP master course by the RCPCH website. It is a very concise book and it has good material. And it is framed and organized in a better way with images. And the images given in the master course book are actually the images that most of the times they give in the exam paper. So it's not a bad idea to go through the images once in a while if you're getting confused. Because what happens with survival guide is that they don't have images in them. So it gets a little monotonous while reading it. So AKP master course is good in that case. And then you can move on to clinical cases AKP. Now, clinical cases AKP also, I'll tell you an idea about how to go about it, because if you don't have time, and I strongly believe that you don't need to take off from work to prepare for the exam. You can do it simultaneously while working as well. You just need to be consistent. It is consistency over quantity anytime in this exam. And so yeah, either way, more than 6 months or 3 to 4 months, 2 books that you should complete is survival guide and clinical cases of AKP. Clinical cases of AKP is by RCPCH only. Then let's come to the questions. So for the question bank, there are recalls that is must. That's like a 5-star must for AKP exam, or for that matter, MRCPCH exam. Recalls is a must. And if you're through with the recalls and you're done with the recalls and you want to read more questions with understanding, then I would suggest go for new format book. And it has good number of questions available there. You can, after you're through with recalls, then you can move on to new format. Okay. Right. So when you move on to the survival guide, now if you have given your AKP paper, if you have given your FOP exam, then you don't need to read through musculoskeletal system from that, from the survival guide. But if you are new, absolutely new, and you've not given any other exam, these are the units that you should skim through. Now, when you're reading through survival guide has starting few pages of introductory section about where they have just they're just telling you that, if this is the size of the blood cell, then what, if poikilocytosis is there, then what are the causes of poikilocytosis, like that. So you don't need to necessarily read through that if you have less time. You move on to the clinical part of it. You move on to the diseases which is mentioned in the survival guide. And you move on to, so these are the units that you should absolutely do from survival guide. And when you read survival guide, you'll realize that when you go back to recalls, the language that is given in survival guide is the exact language that you get in the questions in recalls as well as in the actual exam. And when you're reading survival guide, see, in the exam, it is all about seeing the key points or the key words, because usually when sometimes we reread and read things, we'll realize that keywords is what we catch on to. Because even in recalls, you don't really get the same recalls because they're just not framed the correct way, or they're not framed in the right way. But if you're able to catch on to the keywords from survival guide, understand the concept, take it to the recalls, then it'll be easier in the exam as well. Okay. So now you must have seen this PDF. These PDFs are rotated in a lot of groups also on AKP. So what I would suggest is that you can follow a unit-wise approach. Now, how to follow the unit-wise approach when you're approaching the exam? Let's say you have decided that you've given 3 days or 4 days to respiratory system. Now, if you've given 3 days or 4 days to respiratory system, you need to make sure that you have a theory part of it. So you need to do some reading. Then you move on to the questions. Simple. It's not a lot. So you move on to survival guide. Now, if you approach survival guide in small sections, and if you approach all of this in small sections, it's not a lot. So you start reading survival guide today. You read the respiratory section of it. Then after reading respiratory from survival guide, you move on to the AKP cases. Then you move on. Now there are only 3 AKP cases. 3 AKP cases is not going to take you more than 30 minutes, hardly. What I used to do when I was posted on my night shifts, or when I was posted on duty for long hours, for 36-hour shifts, I used to read AKP cases during that time. I got it printed, and I used to read all those 3 cases. So now if I have decided that in these 3 days I'm doing respiratory system, then I would read those 3 cases and keep it aside. Then I know that it's done during my shift. And it's actually very interesting once you start reading, because they give explanation. It also helps you in the questions, because that they teach you how to cancel out the other options and select the right option. So if one option is not the right answer, they've given an explanation there, which you can quickly note down, and it's going to help you in recall. So you move on from survival guide to AKP cases, and then I would suggest you do the recalls, and after recalls, you move on to the new format. Now about these other sections. This is Abu Bashir and Abu Nadir books. These 2 should be your last priority. So when you move on from this survival guide, now if you're reading AKP master course, you can also give it a read here only. Then you move on to AKP cases, then you move on to recalls of respiratory system only, which you'll be able to find a PDF. So the Arabic writing is actually Abu Bashir and Abu Nadir. These are the 2 books that are there. So the first one, this is the Abu Bashir notes, and this is Abu Nadir notes. And so if you have more time, you go from survival guide, you read, so you read from survival guide, you read AKP master course, then you move on to AKP cases, and then you move on to the recalls and No, they are not theory. They're actually MCQ with good explanation. They're not exactly theory. They'll be in that section of part. Okay. So then you move on to the new format after recalls, and no, they're not in Arabic. They're in English. But I would still suggest that you go for this in the last. So there are PDFs and books available for that. Okay, and remaining for FOP cases also, if you have read for FOP exam and you have read these cases, it will be easier to go through. If you have not, if you have less time, there is no need to stress about it. You can easily just skip them and just make sure that the two books that are absolutely you're through with are Survival Guide and AKP cases if you have less time. And then recalls, of course, a new format whenever possible. Okay, so this PDF can be shared if anybody needs later on. Ask me in the group, WhatsApp group. I can send this PDF later on. Okay. All right. So now, hold on. Sorry. Yeah. So this is the syllabus for the exam, and yeah, there is a lot of radiology. I was going to come to it. So radiology section also, there are books available, but more than books, I would suggest, so like for example, radiology in the recent exam that I gave and in most of the exams that I've noted is from the respiratory section of it. And even if it is not from respiratory, you'll realize that when you go through the AKP master course book, they have many images there, which makes it easier for you to understand what kind of questions they might ask. So it's most of the time it's very easy, like it's usually pneumonia or pneumothorax. But of course, there are other images as well, which many PDFs are also available. And I would strongly suggest to at least go through the images from the respiratory section, the X-ray images from respiratory and from cardiology. Okay, now this is the syllabus given by the MRCPCH website. And in this, they have given that these are all the basic units that you must have seen everywhere. So in this division also, which they've given, I have not really paid, I would not say that you go according to this division because you need to study most of the things. But if you see in this also, this 48 to 58%, they're telling cardiology, diabetes, endocrine, emergency medicine, gastro. These are anyway important topics. So it's not like you can skip these topics. So you have to pay more attention. And then infection, neonatology, respiratory with ENT, it's going to be lesser marks, but again important. Then other than this, the sections that you need to do is EEG, ECG, audiograms, UAC, UVC. Then there is cardiac catheterization. There are some ventilator questions. If you once get the gist of it, or you get the hang of the questions, then it's not very difficult. Then there are radiology images, of course, and then there are important images. When I say important images, again, I'm telling that there are many PDFs. If you want, I can send the PDFs later on in the group. But you can find them in most of the MRCPCH groups. Okay. For the images, it's important that you keep on revising before the exam. Because when you're looking at the images, it sometimes gets confusing because you won't get the exact image, but they're just recalls. So you can just see that if those questions are there, if those images are there. Images would be like, so there are many diseases, right? There are genetic disorders. So they would give you genetic disorders and they will tell you that, for example, they would give Marfan syndrome and then they would give an image with it. So they can ask you questions with images or they can just give an image and give you one line question. So all those are important. Then, okay. So now how to approach recalls is something that I feel like, okay. So when I first saw recalls and I didn't have any guidance and I didn't understand, I felt like it was very confusing to me about how do you see this question because it's not a very well-framed question. Most of the questions are not very well-framed. So what I usually do is, this is how I would suggest. So like, for example, this is the first example we're taking. So ate cake in a party, developed anaphylaxis, received IM adrenaline, went to nearest emergency after 5 minutes, received oxygen, IV access on place, and he still has edema in the face and still tachypnea, which could be suggestive of shock in this case. So what will we do next? Now, first of all, it is an emergency, as you can see, anaphylaxis. You can quickly note down beside your recall that from the anaphylaxis guideline. So now, because it's an emergency case, I would suggest you go to the pediatric guideline and you see the guideline once. And then this is from the guideline actually. So when you approach guidelines also, you don't need to read through everything. So you see the recall, and from the recall, you realize that anaphylaxis is an important topic, but I don't need to know everything in anaphylaxis. If I've already read through that these are the symptoms and you already know the symptoms, then you can move on to the treatment part of it. And now this is from the guidelines where they tell that less than 6 months or 6 months to 5 years, you give 150 microgram, 1:1000. Then from 6 to 12 years, you get 300 microgram. And from more than 12 years, you give 500 microgram. So, and this is also there only that after 3 doses of IM adrenaline, you move on to IV hydrocortisone. Then the fourth one with nebulization adrenaline. So here, this would be first, then second. So now this is something that I suggest usually when I talk to my juniors as well, that when you're approaching the EMQs, that is the long questions, when you're studying those for the first time from the recall, how you should approach it is that you see all the options and you write down whatever you know about that disease. So like, for example, if we're considering Lyme disease, now whatever, this is something that I had written down after studying by myself. So Lyme disease, there'll be some sort of history of travel present. There'll be erythema migrans present. There's going to be neurological features present. There's going to be arthritis, arthralgia, uveitis, and carditis present. Now, Lyme disease is also one of the guidelines that's important. So that's where I have taken this from. The treatment for doxycycline more than 9 years, amoxicillin less than 9 years, and clinical diagnosis. This is the gist of it that I've written, which is very like more important points of what you'll get in a question. That much. Then next would be reactive arthritis. So reactive arthritis, you will get upper respiratory tract infection, arthritis, arthralgia involving the lower limb and self-resolving some of the features. Now what happens is, like we've written already, when you've written all these points about all the 5 options given in the EMQ, when you actually approach the question, it's not so difficult to solve it. Now this will help you in the actual exam, because when you see an option, here these 3 questions are given in the exam. The question could be about JIA also. The question could be about septic arthritis also. It's not necessary. It's not necessary that it will be about these 3 questions only, exact questions. So when you do this, you get prepared for all the 6 questions, which is, if you keep on collecting it to all the EMQs that you have in your recalls, it will sum up to a huge chunk that you will feel confident about. So like, for example, if I see the Lyme disease question only, a 14-year-old who was in camp presented 6 weeks later with lethargy, right knee joint pain and swelling. The CBC showed neutrophilic leukocytosis. Now, leukocytosis or lymphocytosis or lymphoid hypoplasia is also something that you see in Lyme disease. And there is history of camp. So there's history of travel, camp, forest, something like that. Plus joint pain, plus arthritis, arthralgia, arthritis, arthralgia, and leukocytosis would all suggest towards Lyme disease. Now that I had written it here before moving on to the question, it becomes easier and you actually understand what you're going for. Okay. Okay. Now next. Now this is a very common doubt that everybody has, that what about guidelines? Like, where is the list of important guidelines? What all guidelines do we need to read? They are so huge and we can't read everything. So for this, I would just suggest that you go for the major topics like asthma, epilepsy, anaphylaxis. And when you go through them, try to go through them in a way that you're going, the treatment part of it, the diagnosis part of it is more important. And you don't need to go through the signs and symptoms and the detailed section in that case. And whenever you're doubtful, and the second suggestion that I usually give for guidelines is, whenever you're doubtful about a recall answer, try looking for the topic in guidelines. If it's there, give it a read. So as simple as that. So whenever you see a recall and you feel like, so now see, if you ask a question in a group also, it's not necessary that the answer that they've given in recall or an answer that is there in the group could be right or wrong. There is a lot of confusion. So you look it for yourself, right? You go to the neonatal guideline and you go to the pediatric guideline and you try to find it. And if it's there, then you give it a read, because if you have read it there, then your answer is going to be 100% correct. Then you don't have to be in the doubt of whatever that person is telling or what the other person is telling. And that's how you know that's an important guideline. So you just go through the important guideline. Okay. This is there. Now, I've just given one example of one of the important guidelines. If we talk about important guidelines. Now, HSP is a very common topic when it comes to AKP exam. I've seen HSP questions are very common. So when you go through this guideline, how do you go through it? Or because later on, at the end of the day, it's a huge exam. And you have to, when you approach it, you have to see that, and the last day, what all will you be able to revise? So you can note down quickly and you can see here that rash, purpuric raised on extensor surface, buttocks, arms with surrounding erythema, the major point of it. Then what is important here is the monitoring and the treatment part, which I've told you. Otherwise also, in guidelines, you focus on the treatment and the monitoring, or the management, basically the management section of it, treatment, diagnosis, and monitoring section. So this would be it, what they have given here. Okay. All right. Now, coming to this, I would, okay, now one would ask, what do we offer and why this coaching, or why us? So in our case, we do the reading and research and compile everything to provide sufficient concise notes. We tell you about the important guidelines. That is one of the doubts. And we discuss the guidelines in the class. We have recall discussions live in the class. There are 3 mentors for the entire course, mock tests after every unit, and round the clock help in groups, WhatsApp and Telegram. Okay. So anybody, any question? Anything you'd like to ask? In the group, you can type in the chat box also if you don't want to speak up, that's okay. Okay, so the details of the, no problem, I'll tell about the radiology part again. So the details of the course is going to be soon out. We are planning to probably share it in the next 1 month or something, so I guess. So, and we are going to inform you soon about it. It's not recorded, it will be live, but you can, like you will get recorded lectures as well. It's going to be live classes only, not just recorded lectures. And for radiology part, I had suggested that you go through the images given in MRCPCH AKP master course, the RCPCH AKP master course. And yeah, so we've shared the number if you want to know more about the course, and you can just message on that WhatsApp number. Yeah. So for radiology, other than that, if you join us on the WhatsApp group, I can share the radiology PDF as well. There is a radiology PDF, important images as well. But mostly, I would suggest that you go through the AKP master course, because RCPCH has given those, and they've given excellent photographs in that. And it's very helpful for the actual exam. Anything else? Anybody else? Okay, source of the guidelines. So source of the guidelines is actually, there's a PDF, the pediatric guideline 2020 to 2024, I think, or 21 to 24. And there's a neonatal guideline separate. So there are 2 guideline PDFs where you have all the guidelines mentioned in one place. You don't need to go to the NICE guidelines again and again. Anything else? Anybody? Is anybody planning on giving the exam anytime soon? If it's there, if you'd like any other extra guidance, or if you've given FOP tasks before.
Just wanted to know, ma'am, whether AKP Master Course book is mandatory to read.
No, it's not mandatory to read. If you have more than 6 months and if you have a good amount of time with you, then you can go through it. But otherwise, it's not mandatory to read. For images, you can just go through the respiratory and the cardiology images, the X-ray images specifically, just to get a better idea.
Okay, ma'am. Any last minute exam tips or anything you have for the exams? Revise the topic in the end.
Okay. When do you have your exam?
I'm giving in Jan, actually, 24.
Okay. Okay. So for last minute, I would say, are you through with the recalls?
Recalls I'm doing, ma'am. I'm doing the recalls at present.
Okay. So I would suggest for you in January is that now you focus on your recalls and you take the last 3 years. So this 2023, 2022, and 2021, all 3 diet exams, and you try to finish them at least 3 times. And yeah, because see, you already would have your study material by now, and it must be very, it must be difficult to go through them. So what I did in my last month was you focus on your recalls, you have them collected. If you want to go through any guidelines, then you refer from your questions. So for example, if you're solving something and you find some important topic and you feel like I read it somewhere else, then you go take the retrograde approach, and then you move on from the question to the topic, but don't get stuck on the topic because most of the times we get into depth of it. So don't get stuck there. Move on to the next question and try to divide it in a way that 2 days, if you're giving to, let's say the last, if you're solving 2023 exam, right? So there is 3 papers that you have to solve. You do those 3 papers and then you move on to the next. Like you move on, next day is going to be, yeah. So 3 days, 3 years exam papers should be done. Then you move on to your other unit-wise division recalls. You revise them. And then you move on to these 3 years exam again. So this is how you do so you do spaced repetition of those 3 exams.
Exams. Okay, ma'am. Thank you. And past test, is it mandatory to complete the past test, all the questions?
Oh yeah, I'm so sorry. I was going to talk about past test also. I forgot about it. So past test is not necessary. It's not, because I solved past test in my FOP and TAS exam, and I realized that it is very vast. And it has, so when you see the questions in past test and actual exam, there's not a lot of similarity. Instead, if you, like I said, if you try to focus on the keywords mentioned in the recalls, as well as even in past test, if you've done recalls, if you go to past test, you'll realize that most of the questions, when you do it, if you are able to catch on to the keywords, then you can solve the question. But there are some topics, like if there is a question which you feel like, oh, I've never seen this question and this is a recall, it was not there in the recalls, then it is not very important because past test will take you too much in depth. You don't need it that much.
Okay.
Yeah, you don't need it that much. But having said that, if you have already bought it, what I was doing was, so like if you have your exam in Jan and you're through with the recalls one for 23, 22, and 21, you try to give the exam once, the past paper exam. You'll actually realize, the mock exam, because I think the exam is on mid of January, if I'm not wrong.
Yeah, 24th.
24th. Okay. So if you have it on 24th, then right now is the right time if you've done your recall. That way you'll realize that your past papers has actually prepared you for the exam, because their past paper questions in the past test is quite similar. And if you're able to score well, then you'll feel confident about it.
Okay, sure.
Yeah.
Thank you.
No problem. And if anybody has not, like if anybody is planning to give the exam later on also and want to take past test, or I'll tell you, so I did take past test for AKP and for FOP and TAS, all 3, but I did not study from them a lot. Like for FOP TAS I did, not for AKP. And what I used to do was, when we were in hospital, it's very difficult to read things. So I can't carry my books along, and I can't read when I'm on duty and I'm moving around. So it's very easy to do those questions. So when I bought those, I was just doing the questions on the move. So if I was going on an ambulance transfer call or something, then I used to just open and I used to download those 20 questions and solve, which gave me a confidence that recalls was also helping me enough. But it was just because under the pressure of buying the pastas I had. But otherwise, even if you have not, it's fine.
Thank you, ma'am. Thank you so much.
Anybody else? Okay. Would anybody else like to ask any question? You can ask in the chat box as well if you don't want to ask otherwise. Okay. Shall we end the session then? So it's fine with everybody. Okay then. Thank you guys for joining today and listening. If you have any doubts, you can ask. Thank you.